phone here where we have Rear Admiral John Menoni, a Joint Region Marianas, joining us on the link. It's the Breeze 93.9. Good morning, Rear Admiral.
Good morning. How are you?
We're doing good. Welcome to the link. Welcome back. I know it's been a little bit since we had you on last. There have been some developments. And what do you want to start with, Bree?
Right. Yeah, I wanted to start with the health protection condition, HPCon B, and the decisions and factors to designate Joint Region Marianas and the military bases into this particular condition.
Okay. So the actual term we're using is health protection condition Bravo B with mitigation measures or additional measures. Also, people use the colloquialism HPCon B Bravo Plus. And the reason we transitioned to that is since about September 19th, I believe, looking at my chart here, we've been bouncing within the DoD enterprise, and that, just so you know, the folks that I track specifically are obviously active duty service members across all services, guard units here. I track dependents, retirees, veterans, and anybody who's in a reserve status. Since about September 19th, so more than a month, we've been bouncing around between 20 and 30 total active cases of COVID-19 across that pretty large group of folks. And that's not 20 or 30 a day, that's 20 or 30 total that we've been looking at. So we've been flat for over a month. So that's reason one why I felt the appropriate to scale back a little bit from HPCon Charlie, which is the highest condition we've been in since March, when this all started off. And then the other reason is to more appropriately align our condition and our protective measures with government of Guam, who recently started to open up some services, and the governor has changed from, this PCOR 1 stay at home to a PCOR 1 safer at home, which allows a little bit more freedoms. So that's kind of the two real reasons that we loosened up a tiny bit.
Mm-hmm. But there's still a myriad of protections, I think. Is that what you said, or that are in place?
Absolutely. The majority of the protections and restrictions still remain in place that we've seen all the way through HPCon Charlie. But in Bravo Plus, I can do things like maybe open the beaches for limited recreation, family units, less than 5 people in a unit. I can open up an MWR facility with the appropriate physical distance and at a limited service level with limited patronage. So those are the things that we're working through right now.
So just so I'm clear, so HPCon C or HPCon B is like a PCOR 1?
No, so they don't exactly align, Sabrina.
Okay.
So our highest health protection condition Delta, and that's when we basically shelter in place. We shut the gates. Everybody hunkers down and waits out whatever's going on. Health protection condition Charlie is one step below that, and that's what we felt aligned with PCOR 1, stay at home, back in March, and then in the most recent outbreak, which started sometime at the middle of August. So we went from Bravo Plus back to Charlie, so we went to a higher condition, as the governor went from PCOR 3 to PCOR 1. Right. And now, since she's in PCOR 1, safer at home, we went from HPCon Charlie to Bravo Plus. So we became a little less restrictive.
Right.
Again, more aligned with the government.
Right.
I hope that helps.
But Admiral, so there with the HPCon B, I saw there was some additional language there about mask wearing, and so could you kind of go into what are the protocols for GRM personnel, and what are the current restrictions under HPCon B, and are there any restrictions on activities relative to where they can go or what they can do outside of the base facilities?
Sure. So within the health order that I put out, we mandated masks on and off base. We mandated, physical distancing. We mandated the hygiene piece, the three things we've been talking about since the beginning. We also added an additional one which placed the responsibility onus on the individual service members and their families to, if they are in a situation where people aren't adhering to masks, hygiene, physical distancing, that they have an obligation to leave, to get away from that. So those are the primary things that we put in that public health order that I did when we went from Charlie to Bravo Plus.
Mm-hmm. So, as everybody knows, DoDEA is going to be going back to returning to face-to-face instruction. I was just curious, did HPCon B, could face-to-face have returned under HPCon C?
It would not have.
Okay. So DoDEA Schools, they start on Monday, is that right?
Yes.
Okay. And so can you tell us a little bit about the decision behind why it's a good time to restart face-to-face when you do see, for example, GDOE, they're not comfortable with returning to face-to-face and more than likely will do it in January?
So that's a great question, and that's an area where we're a little bit misaligned, and I would point to we have different populations and different procedures. So Guam, DoDEA Guam here, is the last, and in fact the only DoDEA region or group of schools that is not open at this time. We've been the slowest, I guess is the best way to say it. I'd like to think of it as the most deliberate in how we look at opening. Now, there's been no pressure on me to open the schools. The only pressure that I feel is that as the husband of an elementary school teacher, I feel that in-person learning is always going to be better than virtual learning. And so it's important to get the kids back into schools and work through this current pandemic in a manner that we minimize the risk to students and teachers and then faculty and others that work at those schools. So given the low cases that we've seen on bases, given the fact that Gov Guam is starting to open up a little bit, or has opened up a little bit, given that we're seeing good practices by the majority of the DoD enterprise, I felt it was appropriate to open up the schools. Now, as we move forward, we've taken some steps to both communicate about the mitigation measures we have in place and then practice, a tabletop exercises and walkthroughs to prepare ourselves should we have any sort of positive case within our brick-and-mortar schools.
Do you have any testing protocol? And I know you mentioned that you've seen for the most part an adherence with the DoD personnel, but how much of the DoDEA staff is civilian and from outside the, DoD apparatus or whatever?
I don't have those numbers in front of me. Sorry about that, Chris. I will tell you, though, that, there are mandatory health screenings both by parents and the schools of those students each and every day. Kind of the same thing you see when you go into any establishment. And it is incumbent on the parents and the students to practice the mitigation measures that we know that are very effective to preclude the spread of this virus.
Can you talk a little bit about the scenarios you were referring to in the tabletop exercise?
Not in specifics, just because I don't have them in front of me, and that was a few weeks ago. But I'll tell you, one of the things we looked at is, as we look at with all our organizations on bases, so think a ship, think a headquarters building, think a school, when we suspect a person is potentially COVID positive, we immediately send that person home into some sort of isolation or send them to the hospital, depending on symptoms, to go get tested. And then we immediately do contact tracing on that individual. And then we decide how much of the service or school or headquarters building or ship do we have to shut down based on that contact tracing. So a scenario, and this is my own personal scenario, a student shows up and we contact trace quickly and understand that the student really only had contact with their class on that given day. Then maybe we're only looking at isolating and quarantining the student, the family, and then the classroom that student was in. Maybe we can contact trace as something bigger to it's a wing of the school, and then we look to close down that wing and obviously go through all the cleaning protocols. And then it's entirely possible that we would have to shut down a school for a period of time and go through a deep cleaning of the whole school. So there are definitely different levels of what we would have to do given what we know from the initial notification of a potential positive and then any sort of contact tracing and investigation following that.
Mm-hmm. Were the teachers and parents, were they surveyed prior to this decision to restart face-to-face was made?
We've had town halls on this. We've talked about it. We've involved the teachers and the parents in the TTX. Obviously we couldn't have every single teacher and every single parent at these tabletop exercises. And I haven't personally talked to every teacher, so I'm sure there's some concerns out there, both among the parents and the teachers. I have concerns about this too. But we have to work through this together, and if people do the right things, the big three, the mask, the distance, and the hygiene, I anticipate we'll be all right.
Mm-hmm. Right. So when the kids return to school, what are they going to see? Are they going to see like plexiglasses, on the desk? Are the desks going to be 6 feet apart?
Yes, that's a great question. So they will see, and I'm looking at pictures of it right now in front of me. They will see plexiglass in the lunchrooms, around their desks, additional distancing between the desks, up stairwells that are just only up, down stairwells that are just down, kind of like a ship. Mm-hmm. Something else to consider, DoDEA at the beginning of this school year gave students and parents the option of going full semesters in a virtual learning environment. So I'm going to differentiate between virtual and remote. So there's a segment, a population of students that have opted into a virtual learning environment, in which case they will take all their classes online and be taught online. And they can't opt out of that to come back to brick and mortar until the semester point. Then there's the remote learning environment, which is what most students have been in recently because the schools have been closed. So people in the virtual learning environment stay in virtual. People in the remote learning environment will be able to come back to brick and mortar schools. So that's going to limit or reduce the population and demand within the brick and mortar buildings.
I see. I wanted to move on to
Sure.
There was a release that came out, and maybe you could talk a little bit more about that. The Joint Region Marianas awarding $2 million in support of a cooperative agreement with the National Fish and Wildlife Foundation to initiate a foundational conservation alliance in support of the advancement of habitat conservation on Guam.
Sure. So we help with those types of grants. We work through the process, which is, and I'm going to read it off to you just because I always forget it. It's the Readiness and Environmental Protection Integration Program, and that's administered by the Office of the Secretary of Defense, so OSD, big Pentagon, big Navy, big DoD. And the intent of this is to leverage existing plans and programs. We're improving the priority habitats with Guam Department of Agriculture and other partners here on island. So it's to better understand and prioritize and potentially work through any issues with priority habitats here on Guam. I see it as a big win for us out here as one community.
Right, and I think I read a statement from the local Department of Agriculture also excited about this partnership. What about any discussions with the government of Guam or the governor of Guam in terms of any partnerships in COVID response? Because, while you're only seeing 20 active cases within, since September, we're seeing a surge of cases.
And we know these conversations have been had about resources and the availability and the sharing of resources. And I remember, I think last time we talked, you said that an ask had to be made to mobilize you to allow us to avail of some of these things. So what's the status on that? Has GovGuam made a request? And if we are going to get the resources, what would the timeline be and what would those resources include?
So, great question, and it's always good to be able to talk through this process because sometimes, these bureaucracies are tough for any of us to understand. First, there has to be a need for those resources. So, I'm not minimizing what we're seeing in the local community in terms of rising cases of COVID positives. That is certainly concerning. But one of the reasons we're seeing those cases is because the government of Guam is doing what I believe is a really good job of basically surveillance testing to understand the environment and understand where the positives outbreaks are, where the hot spots are. And it's pretty impressive from my perspective, seeing what this island is doing, trying to understand that. Of more concern to me, obviously, are the hospitals, the hospitalization rates, the ICU rates, and then within the ICUs, the ventilation rates. And then what subsequently could happen, which we all hope doesn't, is the morbidity rates. So we watch those all very closely with GovGuam. And as does the 18th Medical Command, which was out here back in March. They're based out of Hawaii, as does U.S. Army Pacific, which is based in Hawaii, as does Admiral Aquilino Pacific Fleet, watches this stuff every day. And I actually just got a call from one of the FEMA administrators for the region out here to set up a call to discuss what's going on. So everybody's focused on Guam in this outbreak. Right now, though, the only current open mission assignment, which is what happens when Guam requests from FEMA for some assistance, and then FEMA assigns that mission to Department of Defense, has to do with telemedicine. Reach back to CONUS or Hawaii to discuss with physicians any sort of cases that are ongoing. So that's the only open mission assignment that we're working through. But as we've discussed in the past, Pacific Fleet intentionally left the Expeditionary Medical Facility equipment here on Guam, which is down, kind of packaged up in the Santa Rita complex, right across from the Payless there, in the event that GovGuam would need that. Also, FEMA has pre-positioned a couple of, they're called FMS, basically hospital sets here, should we get to the point that hospitalizations actually exceed the bed capacity, not the provider capacity, but the bed capacity. And then we always watch very closely with GovGuam and GMH, the contracting actions to get additional providers in. So I hope that's helpful to people.
Well, we certainly thank you for joining us on the show and giving us some time. So thank you so much, and stay safe.
Hey, Sabrina and Chris, you guys stay safe too. I know it's a concerning time for all of us, but we're going to get through this together.
Admiral, there's some virtual corned beef fried rice in the KUAM News Zoom room if you want to grab some on your way out.
I am all about fried rice, so we'll do that. Thank you so much.
You got it. Take a couple there for the staff, Admiral.
Let's share some with Lieutenant Commander Moore.
He doesn't need to eat any. He's already too big. Tall. Too big, tall.
Big and tall. Got it. Thank you, Admiral.
Thank you.
All right, take care.
Take it easy. It's 9 o'clock. Good morning.
I really appreciate that.
Yeah.
You can say that about your staff when you outrank them.
I just want to go back to what I said yesterday. It's crazy that we get the Admiral to come on and answer 30 minutes worth of questions, but
We're coming right to you.
we can't even get our own governor. That says something. It's 9 o'clock. We're KUAM FM in Agotnia, Guam. This is The Link on the Breeze. We're back with our Network of Nurses segment on this Thursday, the 22nd day of October. This episode of The Link is proudly brought to you by Carrier, 647-COOL, IT&E, the Thrive Coalition, and Calvo Enterprises. Good morning, Guam.
Stay connected while physically apart. During PCOR 1, Docomo Pacific will be offering curbside service for your